Well, good morning, everybody. Thanks for coming, and it's a good week in the Missouri House as we send the FY27 fiscal year 27 budget to the Missouri Senate today. And in just a little bit here now, we perfected it, of course, earlier this week, and I think this is a fiscally conservative budget that moves us in the right direction. It would appear it's of course before the supplemental, but would appear to be less spending in 27 than we saw in FY26, which is appropriate and necessary. I think it's around $52 billion is where we are, which the operating was certainly well in excess of $53 billion for FY26. And so I think this is a responsible product, and we did have to make some tough decisions, and difficult decisions certainly remain. I'm sure the Missouri Senate will contend with that as they work through the process. And frankly, it's something the General Assembly and state government will have to continue to navigate over the coming years as we wind down the surplus that began about 6 years ago, and with the influx of significant one-time federal dollars that also came to the state of Missouri. And so I'm sure we'll do that. Because in a way we really have no other choice, but I'm confident that the folks behind me will remain to be up to the challenge, and the administration will navigate it in a way that Missourians can and will be proud. You know, for all the focus that has been on, certain reductions or recommended cuts in core spending, I think the focus is lost on what we've been able to maintain. And I think that's very important to note. And so much talk, I think, came into the session about there's going to be cuts here, there's going to be reductions coming out of the House recommended here, and we maintain a record-setting number for K-12 education, for the transportation line, for the foundation formula. It is a significant amount of money, obviously, and we're not recommending any core cuts in FY27 there, and I think that's very important. And then, I think in a way that maybe surprised even more people, you look at higher education. I know there's been a lot of talk there, but we recommended the same level of funding in FY27 as we did FY26. Obviously, we did recommend coming out of the House a different way to fund higher education, really a way for the 21st century, a model that rewards performance, I would say, and focuses on where the students are and who's getting an education and where they are, and letting the state support for their education follow them and not go to just where it always has. So I think that's very important, something I'm very proud to have seen some real movement on this year. We continue to support public safety and prioritize that at a significant amount. Not only are we not recommending reductions there, but supporting Governor Kehoe and many of his recommendations. We're supporting a lot of increases in House Bill 8 for the Department of Public Safety. So I'm really proud, again, of the product we have here, of what we've been able to do and what we've been able to appropriate. There's over $200 million, of course, for the Rural Health Care Transformation Program that was in the One Big Beautiful Bill. We've appropriated for that. There's a lot of good things in this budget, and it's a fiscally responsible approach that Missourians can be proud of. It's what they sent us here to do. It's why they elected us. And I'm very thankful and appreciative to my colleagues, but most especially those behind me, Representative Boggs and my Vice Chair, Representative Davidson, Representative Voss, and Representative Chappell, and Representative Steinmeier, and all their help, my subcommittee chairs and the Budget Committee, the hard work they did. Any questions?
Can you speak on the decision, or anyone else, to restore the funding for self-directed services?
So that is one that was, tens of millions of dollars. It was a recommended cut by the governor, and look, they had good reason for recommending what they did, and I understand where they were coming from and why they thought that made sense. And so I cast no aspersions, because I understand how difficult it is, having gone through this, trying to balance a budget. And it's all hard decisions. There's no easy decisions. And if you saw anything from perfection, I think what it illustrates is that all 50 billion of that is somebody's most important item or priority, whatever it is. And so it's all difficult decisions. But that's one, as we heard from people around the state, as I heard from my members on both sides of the aisle, it's just something that we weren't comfortable doing this year. And, you know, when you look at potential rate cuts, they seemed very isolated. And so, you know, I wouldn't be surprised in future years, and in the past, in difficult times, there have been rate cuts recommended, but I do think they're seen more across the board, and not in such isolated instances. And so was happy to be able to restore those. But again, it led to other difficult decisions, because if you're adding money, then necessarily before you do anything else, you seemingly need to take it from somewhere else. And so it's a challenge, but that's one that was a big priority for a lot of people, and so we were happy to be able to restore that.
Where were you able to find the money to put that one back in?
Well, it all works together in the end. I mean, as I dropped my House Committee substitute about a month ago, we did a lot of things that I think you do in these instances, and kind of looking under the couch cushions, and we swept a lot of funds that maybe had accumulated and been sitting there, and maybe they were intended at one time for another purpose, but they hadn't been spent or aren't needed. You know, near, what, $60 million from the blind pension fund. I swept that. The funding we appropriated out of general revenue for I-70 and I-44, that had been accumulating interest to that fund, which wasn't needed for the project costs. That's over $100 million that I moved back into general revenue to try to help us do some of these things, and enable us to have the resources to move this budget forward. But we did make some other cuts in House Bill 11, most notably probably the outpatient fee schedule, in a new decision item to keep that at 90% of Medicare for Medicaid. And other places as well. A lot of $1 million here and $5 million there, and either eliminating programs or making partial reductions. One of those was tourism advertising, which again, that's one thing you heard about on the floor Tuesday. You have to look at the whole budget, and those reductions come from a lot of different places.
Can you talk about why your approach to the higher ed funding is the way to go, especially since you know that lawmakers have been working years to come up with this new formula for funding?
That's exactly why. And it's not just lawmakers, it's the department, it's the institutions, it's so many people have been working years. Even before this most recent report that came out, 3 years ago, there was a report, a performance funding model of some number of years, decades ago, and it went on the shelf, never to be seen from again. So, I mean, I think your question, that's something to the point. It's all talk, no action. And we just keep talking about it, and just keep talking about it. And every year I've been here, that's great. We need to talk about this. We need to do something on this. Let's talk about that. Let's do that. We never do anything. And nothing, I'm convinced, nothing's ever going to happen by anybody. And I get it, and it makes sense as I've thought about it. The institutions are not going to be able to agree on their own, unanimously, on let's do this. And they're going to bring it forward, and we just rubber stamp that. That's not going to happen. And so the only way we're going to get movement on this is if the General Assembly, the policymakers, make policy for higher education, which is what we should do. It's incumbent on us. It's our responsibility. That's what we're trying to do here with this plan. And I think it makes a lot of sense. FTE is one metric, but it considers a lot of things. And what's that?
What else? Besides?
Well, it's full-time equivalent students, so the money goes where the students are. But people want to talk about graduation rates. Well, Okay, if you have a student that only participates for their freshman year and they never graduate, well, that school's only going to get that student's funding for 1 year. But if you graduate all your students, you got a 90%, 100% graduation rate. You get, what, at least 4 years of funding, maybe 5, depending on how long they're there, how many hours they're taking, right? So you are rewarded by FTE. And again, these institutions have other means of support: tuition, fundraising, fees, endowments in some cases. This is state support, $1 billion for higher education. And I think as it goes for the state of Missouri, we need to send the money where the kids are and where they're going to school and empower them. And that's what this plan does, and I'm proud of it.
How do you feel like the Senate is going to receive this change in funding higher ed?
What was the first part?
How do you feel the Senate is going to respond to this change?
Hey, it's their prerogative. They've got every opportunity to look at it themselves and agree with our plan or some subset of it, or come up with something entirely different, or go back to the old way of doing things. I mean, I won't speak into that. It's their prerogative, just like it is ours to look at that. I certainly look forward to having conversations with our Senate colleagues about it and trying to make the case as persuasively as I can, because I think it's high time to do something different when it comes to how we've been funding higher education in the state of Missouri.
Representative Deaton, I know you said there's endowments, other sources that these colleges can pull on, but in the case of Truman, they're getting 53% of their Aristotle, 40, 30, somewhere in that range. Those are large chunks of the budget just suddenly gone. So how are these schools supposed to adapt to these very sudden changes?
Difficult conversations that needed to happen many years ago. Truman State support is near 60% of their total funding, by far the highest of any university in the state of Missouri. Why is that right? Why is that the case? Difficult conversations, but they need to happen. They need to be had. Why does a student from St. Louis majoring in history at Missouri State, the state sends them $6,000 to educate that student, but a student from St. Louis that goes to Truman State to get a history degree, they send that institution $17,000 to educate that student? Why is that right? Last question.
Funding. The governor and DESE were set to pay based on enrollment in May for the child care subsidy. Why did you think it was necessary to include language to prevent the executive department from making that decision?
Well, they haven't done it, and we're well into halfway into the fiscal year. And we've seen a lot of changes across the country. I mean, there's probably not been a bigger news story than one related to child care subsidy in another state. I'm not saying we have that situation here in the state of Missouri. I don't think we do. But I think there's a lot of good reasons to pay on attendance versus enrollment. But one is just simply the cost. If we continue to pay on attendance, as we are right now, we're maintaining the status quo. That's all we're doing. We're able to serve more children. I do think it better enables program integrity as well. And so I think there's a lot of good reasons to do that, and it makes sense to do that. And I think if you're wanting to or need to induce providers or support providers more, the way to do that is how we've done it, and that's through the rates. I mean, we have, in some cases, some of the highest rates based off of the percentage of the market rate study in the country, I believe, before you consider the enhancements we've had that I've obviously recommended to forego. But I mean, we're already paying 100%. We're paying effectively what the private sector pays. What other social welfare program do we do that in? Do we do that in Medicaid? Do we pay what Anthem or Blue Cross or Cigna pays? Hospitals? No, nowhere close. Never have. Never will. That's not how the program was designed. So this program in that way is already an outlier. I'm not saying that's a problem, but I do think the rates are the way to address the needs of providers. Thank you all very much.
I want to ask you a question, a big picture question. You have a $1.8 billion deficit in the operating budget that you're covering with surplus. You will be gone, but that problem will remain in the future budgets. What are your recommendations? What should the state do to close that gap? Because that surplus won't be there in the future.
It's a fair question. I don't remember it being asked in the previous years, but I suppose once the surplus is coming to a close, maybe it's top of mind for everybody. We got to spend less money. It's pretty simple. I mean, it's just got to spend less money. You got to have discipline. Can't be all things to all people. The General Assembly probably should stop passing bills with fiscal notes attached, because I understand and appreciate the fact that, again, everything that's in this budget is important to somebody somewhere and to some member on this floor, and that's what makes this so difficult. And if you're not willing to reduce spending, and we're going to have to, but it proves to be difficult. So it's going to take a lot of hard choices and discipline, and the General Assembly needs to proceed with caution when it comes to fiscal policy. No question about that.
You had all these people come up over on the self-directed services on kind of $20-some-odd million of general revenue. How can lawmakers in the future withstand pressure when there are large numbers of people coming up here saying our money is sacrosanct? As you said, every dollar is somebody's priority.
Well, fortunately, under the Missouri Constitution, Missouri's budget will be balanced. Money can't leave the Treasury that isn't there. And so between the governor and the General Assembly, it'll happen because it has to happen. And these are difficult decisions, but I know that the governor and the General Assembly will do their very best and do a good job in making it all work. Thank you.
Thank you.